Cancer Guidance by Type, Part 8. Dr. Dilip Gadgil, Pune. I was talking about liver cancer and how it can become even more troublesome in its later stages. If it is HCC, hepatocellular carcinoma, there is a handy blood marker. An alpha-fetoprotein, AFP, test can be done, which indicates the seriousness of the problem. The normal value in a healthy individual is 10. But when it goes above 1000, chances are it is cancer. Here's another interesting example. A radiologist's father-in-law was taken for sonography and the son declared that he had HCC. When he got the patient to us for treatment, the liver was swollen and he had acute stomach pain. The oncologist who was working with us asked for biopsy proof before going ahead with any kind of treatment. However, the radiologist refused, saying he was confident that it was cancer. They started fighting over this. I asked them if there was any other way to go about it. The radiologist suggested an AFP test. The value was 40, which didn't really indicate that it was cancer for sure. Our research was going on, and according to the protocol, a biopsy was necessary for cancer treatment. We decided that we will treat him like a regular patient and not consider him for our research. We kept him on a milk diet and he followed it without any complaints. After 3 months, we did the AFP test again. This time, the level was 2400. Now, the oncologist said he was 99.99% sure this is liver cancer. However, without any proof of biopsy, he was unwilling to take the case. I said we would continue treating him anyway. The patient's expected lifespan was 6 months, but he lived on for another 18 months. Unfortunately, his mother, who was 92 years old, died due to old age, and he suffered a severe fatal shock. The point here is that AFP is a good marker for determining whether or not someone is suffering from this type of cancer. You might be wondering about the efficacy of the treatment, since the AFP levels had increased after 3 months of treatment. It is a fair question, but honestly, the increase in the disease and improvement in our immune system both happen simultaneously. If the disease is getting worse, that is what the markers indicate. However, once the immune system becomes strong enough to battle the disease, cancer stops increasing or spreading at that stage and there is a phase of status quo. And then, it gradually starts to slow down and diminish. This process could take 4 to 5 years. Let's discuss this further in the next segments.